School-Based Health Alliance. Welcome to our session today as part of our 2021 Spring and Summer Education Series for school-based healthcare professionals. We're really excited to see you here. I see more people continuing to log in, so thank you so much. And we invite you to introduce yourself in the chat box. You can please share your name, your organization, and your state. And please remember to address chats to all panelists and attendees. Otherwise, only a few of us who are panelists can see your responses. So welcome to today's session. So we're going to go ahead and get started, and I have the pleasure of introducing our speaker today and welcoming you all here. We are the School-Based Health Alliance. If you're not familiar with us, we work to improve the health and children of youth by advancing for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend a majority of their time in school. When health and education come together, great things happen. We know attendance improves and conditions like asthma or diabetes are better managed. Behavioral health issues can get quick and expert attention. And we all know that healthy students make better learners. For today's disclosures, the facilitators and planning team have no financial relationships to disclose. Many of you have signed up to receive continuing education credits. We'll be providing those through a partnership with Community Health Center, Inc. and the Weitzman Institute. And you can see here a list of the continuing education credits and who they're available for. We're going to share with you an evaluation link in the chat box near the end of this session and ask you to please complete the evaluation if you're looking to receive your continuing education credits. We will also accept you completing those evaluations through tomorrow morning at 9 a.m. Eastern Time. And you will then receive a certificate of completion as well as the CEs sent to you once the spring and summer series is complete, which is in August. A couple of reminders for today. Attendees are in listen-only mode, but of course we would love to hear from you via the chat box. So feel free throughout the presentation to share comments or questions or ideas. And again, just a reminder to select all panelists and attendees before sending the message so everyone who's participating today can see it. And if you would like to use closed caption today, please click on the CC button in your Zoom control panel. You can see the image here on the slide. And to let you know, today's session is being recorded and it will be posted on our website after the series is done in August. It's now my pleasure to introduce today's presenter, Jessica Dyer. Jessica is the Behavioral Health Project Director for the California School-Based Health Alliance. She received her master's in social work from the University of Washington and is a licensed clinical social worker. She comes to the agency with years of experience in school-based and community mental health settings, specializing in serving under-resourced communities. She's certified in treating trauma through the holistic mind-body modality, somatic experiencing. She's deeply passionate about school-based health and ensuring equitable access to care for all students. So I'll go ahead and pass this over to Jessica. I'll stop sharing my screen.
Thank you. I'm going to share my screen. And just want to make sure you can all, can you see my screen or the slide?
Yep, we got it, Jessica. Great, thank you.
Okay. Yes, good afternoon, everybody. Thank you for joining us. As Andrea said, I'm with the California School-Based Health Alliance, and today I'm going to talk about trauma-informed school-based health centers and schools and practices to support those. At the California School-Based Health Alliance, we believe that healthcare should be accessible and where kids are. There are currently 293 school-based health centers in California, with that number growing all the time. And recently we've been excited to see a lot of growth in more rural areas, particularly the Central Valley. The learning objectives today are to identify ways to increase trauma-informed practices within school-based health centers, school-wide, and to support education staff in being able to support trauma-informed practices across schools. We're going to go over the background of some of the projects that CSHA has been involved in, the importance of trauma-informed care, framing how we see trauma and resilience, and then an overview of our trauma toolkit and practices. And then we'll get a little more deep into trauma screening and interventions and resources. Just want to invite you to take a moment and notice yourself in space and time, in your chair, or if you're standing. And if it's okay, allow yourself to adjust to the most comfortable position possible. Let your eyes wander away from the computer screen, see what they want to notice, and see if you can allow yourself to just notice what's around you in the room, if there's anything pleasant that draws your attention. Seeing if you can allow yourself to notice the noises that your ears are drawn to. Maybe notice your breath, not feeling like you need to make it do anything, but just notice how your breath is in this moment. Is it shallow, deep, out of your nose or mouth? Can you feel the air against your nostrils or upper lip? And just taking a moment to see if you can get yourself to be as comfortable as possible. Making sure you've got water nearby, a snack if you need it. It is the lunch hour. I want to invite you to take care of yourself during this hour. And if you can, if it feels available, go ahead and just chat into the, type into the chat to all panelists and attendees, one word that represents how you're showing up today. How are you feeling in this moment? Sitting at this webinar amidst everything going on, school-based health across the country. Just go ahead and type in how you're showing up and how you're feeling. And I'll just give a few moments for people to enter their feelings and check in with themselves and with each other. And I appreciate those of you who have already chatted in. So much of trauma-informed work is taking these pauses and tuning into ourselves, seeing what we need in order to feel more regulated so that we can show up for our students in more regulated ways. We know that co-regulation is how students are able to get into more regulated places. So just thank you for taking this moment and this practice with me and chatting in how you're feeling. So a little background on CSHA and our involvement in trauma-informed practices. Through different grants and generous donors, the California School-Based Health Alliance has partnered with different school districts across the last 6 years. And one of the projects was called the Oakland Opportunity Fund. And in this project, we supported school-based health centers in middle schools and high schools across Oakland Unified School District to implement comprehensive trauma programs. Through this project, all of the health centers implemented trauma screeners into their clinic flows, implemented trauma-informed practices across the clinics, and then also across the school sites where they were at, and they increased the interventions for students that have experienced trauma. Another project was the Young Men's Empowerment Collaborative, and this was a 5-year project with the vision to promote justice and healing among young men of color in West Contra Costa County who've been the victims of violence and other traumatic experiences. And then we've also been a part of multiple learning collaboratives and partnerships around learning lessons and best practices around the implementation of the ACEs Pearl screening with adolescent and child populations. So today I'm going to talk about lessons that we've learned from all of these projects. And before we get into talking about trauma, I want to frame what we mean by trauma at the California School-Based Health Alliance. And Dina Simmons writes for The Educational, to ensure that all children, especially Black youth, have the privilege to live full lives. And sorry, my screen is not allowing me to see the full quote. Let me get my notes. Sorry about that. She says, to ensure that all children, especially Black youth, have the privilege to live full lives, educators must confront racism and the resulting trauma from it. If not, we're not really doing equity work, and we're not really trauma-informed or trauma-sensitive. We're just saying we are. At CSHA, we believe that engaging in anti-racist practice is essential to comprehensive trauma work. We recognize that sociocultural trauma, such as oppression, racism, sexism, inequity, homophobia, implicit bias, microaggression, ableism, xenophobia, and classism that students experience in their environments inform their daily lives. These cultural contexts can compound the effects of more commonly thought of traumas, such as violence and natural disasters. When creating trauma-informed schools, it's necessary to address all the ways that trauma can affect students, families, communities, and to approach the work with cultural humility and deep self-reflection of power and privilege. So I really liked this graphic in being able to depict when we were talking about trauma and adverse childhood experiences. I felt like this did a good job of showing that there are the more typically thought of ACEs in the tree in number 1. And those things are screened for in PEARLS and other screeners. But then in the roots underneath, it talks about historical trauma, discrimination, food scarcity, living in a food desert. And then in number 3, the environment, is saying that we also need to take into account climate crisis, wildfires, natural disasters, such as earthquakes. And then pandemics is also on the environmental experiences that we know so many youth have been experiencing difficulty with in this last year. And this is just another depiction from Resmaa Menakem's book, My Grandmother's Hands. And it's a visual of the compounding effects of the layers of trauma that students could be experiencing that we're working with. And adverse childhood experiences are only in the top part of the pyramid that you can see, and underlying are so many things that we need to be mindful of when we're working with and engaging with students, such as intergenerational trauma and historical trauma. These can then have more compounding impacts on the higher traumas on the pyramid. So when addressing trauma and thinking about all of the layers and history and the factors that go into what could be impacting a student's experience, it's incomplete if we're not also focusing on resilience and the strength and protective factors that students have. Hard and challenging things happen, and many students are still thriving even though they deal with traumatic experiences. As service providers, it's our job to help build upon the strength and capacity that's already inherent within students and the communities that we're serving. The National Scientific Council on the Developing Child at Harvard University states that resilience can be learned at any age, and that our brains have the capacity to rewire pathways at any age. And Resmaa, I like the way he says that resilience is built into the cells of our bodies. Like trauma, resilience can be passed down from generation to generation, and change the lives of people's families and communities. The human brain always retains the capacity to learn, change, and grow. He also says when one settled body encounters another settled body, there can be a deeper settling of both bodies. And when we heal ourselves, that can ripple out into our families and communities and spread healthy genes to later generations. So just as the traumatic, there can be intergenerational trauma, there's also intergenerational resilience and overcoming. So today we're going to talk about, with all of the framing, we're going to talk about what does this look like in a school-based health center. And this pyramid is representative of the fact that some of the lessons that we've learned is that trauma-informed practices need to incorporate the whole school and the whole environment the student is working in. And so at the foundation bottom level of the pyramid, we've got things such as family supports, making sure we're addressing staff wellness and staff development, and supports for all of the student body across the school. And then getting more higher up in the pyramid, we have trauma screening that takes place within the foundation of a trauma-informed clinic practices. And then after that, actually having interventions if students have experienced trauma, and then what does the clinical response look like for medical and behavioral health providers. So we're going to do a high-level overview of each of these domains today. And please feel free to reach out if you have questions or want to go deeper in any of them. So the first thing we're going to talk about is family support. And there are so many ways that school-based health centers can support families. We've been really lucky to partner with some school-based health centers that are really creative. And when creating trauma-informed supports, it's really important to take into account whole child needs. And when there's a foundation of safety and security and safe housing and having enough access to food, it can really increase the student capacity for healing. In some ways that school-based health centers supported families have been by hosting parent education workshops on mindfulness and trauma-informed practices so that students can have consistency across what's being practiced at school and at home. Offering self-defense classes and discussions of trauma and the impacts of trauma and domestic violence and connecting people with resources to that. Creating food pantries to help addressing food insecurity. Many school-based health centers have been able to partner with food pantries and provide food in things such as backpacks so that there's no stigma, so that a kid can come, they can pick up a backpack and it doesn't look like, oh, you need to go get food, but they're able to just get what they need. It's in a backpack and they can go home. Families can also, a lot of school-based health centers will have it, so families can come pick up the food and then they're able to create connections informally and sort of get to know people and what they might need in their communities. And this was something that was really helpful, and a lot of school-based health centers continue to do in COVID and when there were many more needs around food insecurity coming up. Some other school-based health centers also hosted immigration clinics. And this can be a huge source of feeling safe in your own home and where you live in your own community. And so they were able to help connect families with immigration lawyers and people who could help them navigate that really complicated system. So the next category of a trauma-informed school and trauma-informed practices is staff wellness. And trauma-informed schools recognize that adult well-being is a necessary component for student well-being. And school-based health centers can help support staff wellness. And they can help schools develop communities that value wellness and supportive relationships. Children and students learn how to regulate their emotions and selves through co-regulation with the adults, the caregiving adults in their lives. And adults in school systems and clinics need to be able to support their own well-being and regulation to be able to support the students. I really like this graphic. I think it's helpful in depicting that self-care is only one part of wellness and self-soothing is a part of self-care. I think that's often what we go to when we think of self-care is those baths or massages, and those are really self-soothing activities, and self-care is when we're more making things routine and ritual, setting boundaries around what we need. And then community care, being able to have access to childcare, being able to have people that you can talk to who will be able to lend emotional support when you need it or you're experiencing struggle, having healthcare and the things that you need. These are all parts of wellness. And we had some great examples of school-based health centers through this project that were able to support the more community care level of self-care. And so some examples are having teacher affinity groups where staff meet on consistent basis according to parts of their identity with the intention of supporting one another's well-being. Having healing-centered support groups to allow staff time to learn and reflect on their own stress responses and how that shows up in the classroom, and giving them tools to recognize when they're stressed and how to support themselves and one another and reach out for help. Wellness groups where staff meet consistently to check in on one another's well-being and create accountability plans with each other. Creating space for gratitude and appreciations through a visual wall or digital communication. We actually have on our website many resources to support staff wellness. And we'll share a link to our website after this. But we've got a couple things coming out. We've got a webinar and then a manual that actually talks about how to incorporate wellness practices to help alleviate the digital burnout, and this person called it Zoom boom fatigue. So there are different practices. And then it's also intended that when we go back, how to incorporate wellness into daily routine, into a part of the clinic flow, into school flow. How do you make wellness and mindfulness a part of practice it all the time? So I'm just going to take a moment and actually lead you guys through an activity, if that's okay. So you can just take anything that you have nearby, a pen, or I've got a set of keys that I have. And I'm just going to invite you to take it in one hand and throw it up and try and flip it and catch it in the same hand. Just take a moment and try and flip it. And then, okay, I've got another thing, so I dropped that one. And then after this hand, try to put it into the second hand and go back and forth. So that's just a really small, short example of taking a moment and things that we can include into our meetings or days that actually take you out of the computer screen and back into your own body and paying attention to your own self and space and time. And that can be a really helpful way to alleviate some of this fatigue that we get from being on Zoom. That our brain, when we're on Zoom, is constantly trying to scan for body cues that we're not able to see because we can't see people's bodies. And so it just helps take us into the moment and reconnect. And that's something you can do with students, staff. But the manual that we have coming out by the end of this week, we're hoping, has a whole bunch of these different exercises that you can incorporate into your staff meetings. Okay, so the next component is staff development, and shifting a school culture and climate to be more trauma informed is a big job. And it includes increasing all staff capacity to utilize a trauma-informed, socially just, anti-racist, and equitable lens across all the systems that support students and families. Improving school culture requires significant investment from school leadership, and particularly around staff professional development. School culture and climate can shift when schools implement intensive professional development, consultation, and coaching for staff around trauma-informed practices and well-being. The schools in these projects invested heavily in professional development on trauma impacts on students and learners, how to be healing centered, and specifically on culturally responsive education. And as you can see in the graphics, after having more intensive professional development, staff felt that they were able to better de-escalate students using trauma-informed approaches. They felt that their school was more supportive and inviting, and students' learning and engagement improved. One teacher said that after they implemented calm corners in their classroom, that the amount of students who would walk out of the classroom actually decreased, and the amount of referrals that they needed to make decreased as well, by shifting the focus on how to support the students' regulation rather than punishing them. Students were more likely to be able to stay in the classrooms. And there's another resource that we're going to have coming out by summer, and it's a curriculum on how to actually support, how school-based health center staff can support educators in these tools around how to create calm corners in their classroom, how to have healing-centered learning relationships with students, how to learning about vicarious trauma and how that shows up in their own selves, and specifically also the calm corner. So all of that will be available in the curriculum we have coming out. So you can just keep checking our website, and we'll send out an email blast as well when that becomes available. So having a more trauma-informed school recognizes that trauma and chronic stress affect all members of a community, and the importance of support for all students. And implementing trauma-informed practices that serve all students, schools can create environments that help to increase students' resiliency and abilities to thrive and learn. School-wide trauma-informed practices help increase students' overall experience of well-being, and then connection to systems of support for students who identify higher levels of need. Some examples of things that school-based health centers were able to implement for all students were having mindful moments to start the day. So over the loudspeaker, there would be a meditation read that was led for the whole day. And that's also in our wellness manual that should be out by the end of the week, is a guide. So you can actually just read the meditations. You don't have to come up with it yourself to help start the day in that way. And some schools actually started training students to be able to lead the mindful moments for the whole school. School-based health centers would host weekly wellness events where they had different activities such as like creating stress balls or dancing, having healthy food options. And so these were things that they would then get to, again, informally connect with students and staff and really be seen as a resource to the whole school community. They would do youth and yoga and mindfulness classes. Another thing that we found that's really helpful is peer health education. And so having classes where they actually talk about social and emotional wellness, mental health, spaces where it's intended for and safe for students to be able to bring up what their needs are and identify what their traumas are and reach out for help. I'm really excited that on April 24th, and you can register for this on our website, we have a training on peer mentoring, peer mental health mentoring. And so we have some people who implemented older students actually becoming mentors around mental health topics for younger students. So if you go to the CSHA website, and I'll have a link to that at the end of the slides also, you can register for that. And it's a really great curriculum. And so we'll have a training on that. So now we're going to get into, well, first, I'd just like to take a moment. I've been talking at you for a little while now. Just want to check in and see if there's anything that's resonated with you so far. Feel free to type in the chat either a word that represents how you're feeling, something that's resonated with you, something that's challenging you, but just go ahead and take a moment and share in the chat how you're doing so far. Anything that stood out, anything that's challenging, resonating, what's going on for you out there? I'll just give a moment to type into the chat what's resonating so far. I'm not seeing too much chat, so I'll just keep going. But if you have questions or anything, feel free to reach out. So in implementing trauma-informed principles into school-based health center clinics. These 6 principles we adapted from SAMHSA and Trauma Transformed, both really great resources for trauma-informed clinics. And I think one place that's really important to always start when looking at trauma-informed principles across your school-based clinic is assessment. And on our website, our Trauma Toolkit website, we have a link to a number of assessments, and particularly one from the National Council for Behavioral Health. And that, if you go through that assessment, you can look at where your clinic is at in each of the different principles and practices, and then help to make goals to help move you along to becoming more trauma informed. And so we're going to go through just some of these things. The first principle that we have listed is understanding stress and trauma. And so some of the ways to do that that shows up in the clinic. I'm just gonna name a few under each of these principles because there's a lot. So an understanding stress and trauma, having flexibility in staff work schedules so that they can support work-life balance. Having morning huddles with the team and including all members of the team, right? If there's a front desk staff, MAs, nurse practitioners, behavioral health, whoever's working in the clinic, making sure they're all a part of the morning huddles. And that being a place where you can increase connection, maybe start with a mindfulness practice and really support each other in self-care. Including relational supervision for staff directly involved with patients, and found that this to be really helpful, particularly if you're going to start having like medical assistants provide and administer trauma screenings. It can be really helpful to make sure that they're also getting relational supervision where they're being checked in with is there vicarious trauma showing up for them, and getting support around that. The next principle is cultural humility and equity. And so in this principle, making sure that the school-based health center, as much as possible, is hiring professionals that reflect the patient population and that are committed to cultural humility and continued self-reflection. Having it be part of the clinic practice to understand how sociocultural factors and structural adversities such as racism impact a person's experience and stress response. This can include social influencers of health as well. Making sure that we're screening for that as a part of practice. Safety and stability, ensuring that patients understand their choice in all decisions and in all paperwork, making sure it's really clear what the limits of confidentiality are, and that any sort of screener, anything that's a person is filling out, that it's really their choice what they want to be disclosing or not. For compassion and dependability, training all staff on how to recognize and build upon patient strengths and provide welcoming spaces. As medical providers, showing you're available and scheduling follow-up appointments to check in and see how students are doing. Having clear descriptions for what the patient will experience in clinic to minimize anxiety. This can be helpful even just in signage, having it be clear where students go, where they check in, who they talk to, what is the process going to be like. For collaboration empowerment, soliciting and incorporating family and patient voices into practices and policies, implementing interprofessional collaboration across all departments. For resilience and recovery, again, including patient voice in treatment planning and drawing upon strengths in the treatment plan, ensuring that all staff are trained in the impacts of toxic stress and burnout and supported organizationally to care for themselves. Facilitating group interactions for sharing, healing, resilience, and lived experience, and including peer supports as part of the team of health professionals. And sometimes that can be a really great way to help bolster staff that represent the student population. So the next slide, so take a drink of water. We're going to talk about trauma screening. And screening is one part of trauma-informed practices, and making sure that it's done with in the foundation of having already established trauma-informed practices, and that it's done within a relationship with a trusted provider. Screening is a process that takes careful consideration in order to be effective and supportive to students. There are many possible screeners available, and every screener is a tool to be used in the context of a safe and trusted relationship with the provider. When screening for risk and trauma, it is important to also screen for resilience and protective factors, and to take into account the student's overall well-being. Youth from our YMAC project, the Young Men's Empowerment Collaborative, said that they felt much more respected and willing to complete screeners when their strengths and resilience were also screened for. Teens in the Bay Area identified feeling more comfortable with the de-identified Pearl screener for the ACEs, as opposed to the identified screener. Additionally, it's important to include education for the student as to why screening is taking place. Screening can be used as a tool for prevention when it's included as a part of a psychoeducation and connection to building upon students' resilience. At CSHA, we recommend including education and screening for resilience as part of the practice for screening for trauma. And for example, one of the school-based health centers we partner with through Lifelong this last year rolled out the ACEs screener. They used the Pearls, the de-identified Pearl screener. And before they did the screener, they gave every person that came into the clinic universal education on what ACEs are, the impacts of ACEs on well-being and toxic stress. And then provided the de-identified screener. And so every patient that came into the clinic was getting education on how stress and toxic stress can impact their overall well-being. And additionally, as to education on ACEs and toxic stress, they also got universal education on the stress busters and how to increase resilience for themselves and how to take care of themselves. So regardless of what a screening tool what the number was that they identified on the screening tool, every person was getting education and support on connection between stress and then resilience and how to support themselves. And they in their part of their rollout, they were asking for feedback, and everybody that participated said they understood why the screening was taking place. They understood that it was important, and that those connections were being made for them. So I feel like this is a good example of how a medical provider can respond once a positive screening has taken place. And this is from it's in the notes I have linked to the citation, but just because someone has experienced ACEs or any traumatic experience, it doesn't necessarily mean that they're going to need behavioral health, or that they're struggling now because of that. And so it's important to remember that the screening tool is the starting point for a conversation to assess student well-being and possible areas of need. And so these conversation starters that a medical provider can have with a student after a positive trauma screening, I think it's helpful because it looks at strengths and current impacts on their well-being. So asking if these experiences still bother them now. Of the ones that don't bother them, how did they get to the point that they don't? Like, what are their resilience and strengths factors? How do you think these experiences affect your relationships with your family and friends now? So just really looking at, okay, so something happened, is that impacting your life? And are there ways that we can support and need to get connected to? I also think it's helpful to point out that medical providers and school-based health clinics can be such a big factor in increasing resilience for students. And research shows that one stable and supportive relationship with an adult can increase the student's resilience. Having a sense of mastery over one's own experience and having strong executive functioning and self-regulation skills. All of those things are really important for student resilience and things that medical providers can help support. The research has shown that school-based health, that it's recommended that adolescents beginning between ages 11 and 14 spend time alone with their healthcare providers, and that motivational interviewing is used to be able to elicit intrinsic motivations, and that it's really important to be clear about confidentiality and the limits on confidentiality. Students have said that some of the reasons they don't disclose things is fear of confidentiality and not understanding what the limits are. So as much as possible, with the younger adolescents, being able to start building those relationships and showing that you're trustworthy and dependable, and being really clear and explicit on what can be shared, what can't be shared, what the limits are, can really go a long way in building up that trust. I also like to say that, a lot of times people have hesitancy around screening for trauma, and that there's not mental health providers, and that there is a lack of that. And I like to point out that mental health is only one of the 7 stress busters that that medical providers can help support all other 6 of the stress busters, particularly in a school-based health center where you can connect to other resources and supports for students. So if there is an identified positive screen and a student that identifies that it is something that's still bothering them and that they would like some more support with that, getting connected to a behavioral health provider is a wonderful and possibility in school-based health centers. As a behavioral health provider, I think it's very helpful and important. And so some tips on how to have successful behavioral interventions in school-based health centers are to have consistent meetings and collaborations with school staff, so that you're being really clear and partnering with the school staff where you're at with admin around the timing and location and purpose of the different therapy groups that you might be running. This can allow for more consistency in the services provided. Communicating with school administrators around plans for screening and trauma interventions. This is also really helpful and can help prevent barriers before they get in the way, and also help align universal education and screening and getting buy-in from the school staff around why this is important and how you're going to be able to help. We've talked about this before, but hiring staff that reflect the students served as much as possible. Students from our Young Men's Empowerment Collaborative particularly talked about how helpful it was to have the staff in that project were men who had experienced similar experiences that the students had, and the students really said how helpful it was to have authentic, genuine people who really cared about them and showed up for them. And students who participated in the CBITS therapy groups in middle schools reported that the program helps them to feel safe when talking about their problems, feel like they had an adult to turn to, which again helps increase their resiliency, help them feel less anxious or nervous, help them to stay in school longer. And so these are, you can see the percentages of students that really identified being connected to resilience factors from participating in behavioral health interventions. The behavioral health interventions through this project were varied. They varied from individual therapy to group therapy, evidence-based like trauma-focused CBT, EMDR was used, group interventions such as cognitive behavioral intervention for trauma in schools was a really common one used. Some people did art therapy groups. The Young Men's Empowerment Collaborative actually found that the self-group curriculum was really helpful, and that curriculum can be adapted. You can pull lessons to show to use what's going to be most relevant at that time. The components they found most helpful were goal setting, decision making, team building, healing from trauma, and life schools. And in our trauma toolkit on our website, we've got a link to all the different evidence-based interventions. So you can go there. Most of them are free, so you can get trained in them for free.
Jessica, a question came in about whether you use a resilience scale to gauge improvement over time.
Thank you so much. So I'm not sure about in measuring improvement over time. I haven't heard too many people do that, but one measurement that we do recommend and that the YMEC project used was the Child, Youth, and Resiliency Measure, CYRM, and that's a free measure. That's also linked to in our trauma toolkit under screeners. It's interesting, I haven't thought about but like pre and post, but yeah, you could do it once and then do it again and see if they do have identified more resilience factors. But the Child, Youth, and Resilience Measure is one that was used in conjunction with the PEARLS. And actually the students in the YMEC group used the Child, Youth, and Resilience Measure, and then the UCLA PTSD index, but they used the symptom screener and not the event screener. And so students didn't feel like they needed to disclose an event unless it's something they wanted, but they disclosed symptoms of PTSD. So there are many different ways to go about screening for trauma, but that's what the YMEC, they ended up finding that was the best connection. And then the Lifelong, who's rolling out PEARLS, they use the Child, Youth, and Resilience Measure along with the de-identified PEARLS. So I'm going to talk a little bit about networks, school-based health centers and networks of care. In California, they're rolling out the ACEs screening across the whole state. And one of the things that they're finding in response to ACEs is that, you know, we need networks of care. We need whole communities of service providers working together to support families when there is a higher level of need and more trauma that has been experienced. And I think school-based health centers are in such a unique place to be able to create networks of care. Like naturally, they already are when they're on a school campus and they're connected with, if your school has in California, we call them COS teams or coordination of service teams, or a community school, different models of this, but when service providers are meeting together and connected, school-based health centers being a part of that is just such a great way to be able to identify need and then connect students. And some of the things around creating better networks of care that have come up, that have been talked about. That I love this article, A New Framework for Addressing Adverse Child and Community Experience, the Building Community Resilience Model. They talk about having cultural exchanges where the medical and behavioral health providers actually spend time in the communities where they're serving. And so for school-based health centers, I like to think about this as like actually getting familiar with what's offered on school campus for lunch. What are the options? How do students have access to having physical activity? What are different groups that are going on campus? Like really getting involved and making sure that you know what is available for students on campus, so that if there is an identified need that comes up in a screener, you're going to be able to connect them to a resource or an intervention that will naturally align with one of the stress busters that has come up in ACEs those are physical activity, mindfulness, sleep, nutrition, mental health. I'm missing two, but they're on the slides. But just, yeah, the point is that having school-based health providers really be familiar with what is actually available both in the school and then in the local community for students to be able to access. The other thing that comes up in having communities of care and community resilience is having peer mentors, and peers actually be able to help students with these skills. And so again, I'm plugging that April 24th, we will have a training on this and how school-based health centers staff can support peer mentorship. So this slide is just some upcoming CSHA trainings and resources. That's the link for our trauma-informed clinic, or trauma-informed clinic site. So you can link to all of the resources that I've talked about today, the link to register for our webinar. I did also just include the re-entry guide from CASEL. I think it's really, it's a re-entry guide for with social and emotional learning. I just think it has a lot of really great resources, as so many schools are looking at going back in person right now. So I just linked that. And then the next few slides that I'm going to go over are resources to be able to connect to some of the resources for interventions for some of the stress busters. And these were all informed by the youth board at California School-Based Health Alliance. So this slide has just some apps that students identified as helpful for them in being able to engage in mindfulness practice. And then these are some mental health apps that are free and accessible for students they just have different CBT exercises to help with anxiety and low mood and depression. So, when there's a real shortage of behavioral health providers in an area, it can be really helpful just to have access to some apps. Obviously, it's not a total substitute for having a behavioral health provider, but it can be helpful for students. Our youth board also recommended affirmations they found to be really helpful. So I linked some of the affirmations that they liked here. Leaving toxic relationships, they talked about how that really impacts their mental health. And so it is showing the benefit of school-based health centers and having peer health education groups on healthy relationships and support for that. Journaling, they talked about as being really helpful for their mental health. And so I like to think, like with affirmations, I like to have them choose one that they would like to use throughout till I see them at the next visit. Some tips for physical activity from the youth board were following fitness pages that they felt were more representative of them. One person recommended the underbelly yoga as someone who is more inclusive and representative. They talked about walking to the corner store instead of driving. Again, this is going to be really specific to the community that your students are in, but they talked about having stretching counts, making a habit to breathe fresh air every day, even if it's just on your doorstep, but just encouraging one another to get out. And these are some supports for sleep, apps that they found helpful. So just access to those. And then just like to plug these more also cultural and holistic practices that are really helpful. So if there's any way of getting kids access to these sort of practices in your communities, they can be really helpful. Yeah, so that is the end of my presentation. Just curious if there are any questions, thoughts people are having.
Thank you so much, Jessica. We do have another question that came in, and everyone's thanking you for these resources. This is amazing. Thank you.
Yeah.
The question that came in asks, when using ACE screen, did you experience high volume of mandated follow-up positive abuse?
So that depends. Some clinics, yes, did find a higher level of needing to report abuse, and some found it to be pretty similar to standard care. And I think it is different if you do de-identified versus identified. And so the de-identified screen just asks that the person fills out the screener themselves and then counts up the number and tells you the number. And then they can tell you if they want to, right, what's gone on, versus the identified screener where then the provider would be asking more. And so it's pretty varied upon the clinics, but yes, some did find that they have had an increase in mandated reporting.
Thank you. Another question that came in, do you require consent forms completed for administration of screens?
Yes, that's also a good question. So yes, it's best practice to get consent forms. In California, the laws that minors can consent to their own mental health treatment ages 12 and above. And still we try to get parental consent as much as possible. And a lot of schools would do classroom-wide screeners. So a practice they would do was having, they would have the consent sent home with the classroom before the day they would do the screener. And if the parents didn't return the consent, then the student didn't complete the screener. So that was one way of doing it. Other clinics implemented it that it was just when students came into the clinic for a well child check that they would get the trauma screener. And so consent, there was not specific consent given for the screener then. It was consent for services in the clinic. They had already given that. So it looks a little different depending on what your practice model is and how you're going to roll it out. But yes, consent for screening is a good practice, recommended practice.
I don't see any more questions that have popped in. We'll give everyone one more minute. But if you all take a moment and see that we've dropped the evaluation link for today in here as well, would really appreciate your feedback. And another thank you for all the resources. Good thing we shared your website because I think a lot of people are going to be going there. Let's see, I'm just doing one more check. I think we've hit most of it. Yeah, I think that looks like it was all the questions. So Tiara, I'll just turn it over to you for closing. Thank you so much, Jessica.
Yes, thank you.
Okay, thank you, Andrea. So yes, everyone, if you can please check the chat box, and if you can complete the CE evaluation link, that will allow you to get your CEs and a credit for this webinar. So once again, if you can please complete the CE evaluation link that is in the chat box by tomorrow at 9 a.m. Eastern. Also, CE certificates or certificates of completion will be given at the end of the series, which is in August 2021. Our next session will be April 21st. We look forward to seeing all of you then. So again, thank you so much, Jessica. This was awesome. We appreciate all the information, all the resources, and we knew that you would have so many of them. So we would definitely send a follow-up email that will include the resources. The recordings for the session will be given to everyone once the series is completed, but we will provide everyone with the resources within 2 to 3 business days. That will include everything that Jessica has provided. And again, Jessica, we thank you so much. Is there any last minute things that you would like to add for anyone?
I was just looking through the
Yeah, I
chat.
see one question coming in too. Okay, here we
great.
go. Ah, we got time for a last minute question for you, Jessica. And under the last minute sign, were groups able to be built?
Yeah, that's a great question, and something that is challenging. So we were able to figure out that we could bill for under Medi-Cal, we could bill for 1 student per group. So it wasn't, I think before rolling the groups out, there was this idea and hope that we could bill for all of the students. It would be sort of a more, it would be a great way, it would be more revenue, but it didn't quite work out that way. The way it ended up working out is that you could bill for 1 student per group. You could bill 1 student per group per insurance type. So if you had 1 student with Medi-Cal, 1 student with another insurance, you could do that. But for the most part, our school-based health centers serve a very high Medi-Cal population. And so you could typically bill for 1 student per group, which isn't nothing, but less than I think people were hoping for when this was first rolled out. But the groups, I mean, I personally, as a clinician, for me, I was one of the providers on when they first did the rollout of the OOF project with the comprehensive trauma programs in the high schools. I was actually one of the providers, and I found the groups to be so effective. And you know, adolescents at that time, just in being able to help reduce shame around whether they have experienced. I ran a group particularly for sexual trauma, and you know, but just being able to be connected with other peers who have gone through the same thing really reduced the shame and helped them build self-confidence and build connection to one another. And then while they're developing skills on how to stay more regulated and stay in classrooms longer. And I just think groups are a really wonderful intervention in schools. So while you can't bill for all the students, if you can bill for 1, then it's still a billable hour.
Wonderful. Thank you so much, Jessica. Looks like that's the end of our questions. Thank you again for your time, and everyone stay tuned for your follow-up email. See you all soon. Thank you.